Hello everyone! In this video, I am going to explore 12 essential facts that you should know before using Tamsulosin. If you suffer from prostate enlargement and difficulty urinating, you may be prescribed Tamsulosin. It is one of the best-known medications to treat benign prostatic hyperplasia, and it is widely prescribed. It is as familiar as FLOMAX, as it improves the flow of urine. But before using Tamsulosin, you should know very essential facts about this medicine. So here in this video, I will explore such key facts as how to take this medication, what the effects of food, other medicines, and alcohol are. What side effects can you expect with Tamsulosin? All such points will be discussed here. First, let's see how to take Tamsulosin. Tamsulosin is administered as a hydrochloride salt and is available as a capsule. Each capsule contains 400 micrograms of Tamsulosin hydrochloride, which has been designed for prolonged release. It is gradually released from this capsule over time. This ensures that the drug remains in your body for extended periods of time. You can take Tamsulosin capsules once a day with plain water, preferably after food. Food can bring the smooth kinetics of this medication into your body, avoiding dizziness and drowsiness. When it comes to the time of administration, you can take this medication based on your preference. It can be taken either in the morning or at bedtime. It is recommended that Tamsulosin be taken in the morning, 30 minutes after the first meal of the day. The reason is simple and straightforward. Tamsulosin is designed to enhance urine flow when you try to urinate. So you need this drug more during the day to help you urinate. However, if you feel dizzy and hypotensive, it is better to take it at bedtime. Tamsulosin works in a similar way, whether you take it in the morning or at bedtime. Your doctor may suggest the right time based on your conditions. However, you should ensure 4 things here before its intake. First, you should maintain the same time of intake every day. This ensures smooth and steady levels of this medication in your body that bring the maximum benefit. If you take it at variable times for several days, the levels of Tamsulosin in your body may vary considerably. This may reduce the effectiveness of this medication, or else it may increase significant side effects. Second, whether you take it in the morning or at bedtime, ensure that you take Tamsulosin after food. This helps Tamsulosin reach your body easily with fewer dizzy side effects. Third, you should avoid a large intake of fizzy drinks along with Tamsulosin. These carbonated beverages reduce the effectiveness of Tamsulosin if you take them regularly. They can irritate your bladder, which makes you urinate frequently and causes difficulty urinating. It is always better to take Tamsulosin with a plain glass of water. Fourth, Tamsulosin needs a few days to show its full beneficial effects. So you can see its maximum benefit after a few days of intake. This medication can be used as long as needed, as it helps you pee freely. If you suddenly stop this medication, symptoms may reappear, and you may find trouble peeing. However, if you find intolerable side effects with Tamsulosin, your doctor may suggest a few changes or prescribe an alternate medicine. If you forget a dose, you can take the missed dose at any time of the day, but never combine 2 doses at the same time. Important side effects. Tamsulosin can make you feel dizzy and lightheaded. In the early days of treatment with Tamsulosin, you should be careful while changing your posture. This medication causes a slight reduction in your blood pressure that may cause dizziness. Tamsulosin is a selective alpha-1 blocker that specifically acts on the bladder. Unlike other alpha-1 blockers like prazosin, doxazosin, and terazosin, which cause direct dilation of your blood vessels, Tamsulosin has little effect on blood vessels. Even though Tamsulosin may cause a small lowering of your blood pressure. Therefore, you should stand and sit slowly. You can observe this lightheadedness on initial days, but later it is slowly reduced with continuous use. However, if you observe any severe dizziness even with long-term use of Tamsulosin, you may discuss it with your doctor. You can also have fatigue and insomnia. Next, let's see the effects of food on Tamsulosin. Tamsulosin has no food restrictions. You can use this medication with all types of food. However, you may improve the symptoms of prostate enlargement while taking Tamsulosin by making a few modifications to your diet. First, you should limit fizzy drinks, caffeine, and artificial sweeteners. All these items can increase bladder irritation, leading to urinary urgency. Second, you can avoid the incidence of constipation. People with constipation may have more pressure on their bladder. It causes more difficulty peeing in people with prostate enlargement. You should avoid constipation to improve the symptoms of BPH and enhance the efficacy of Tamsulosin treatment. For that, you can add fiber-rich foods to your diet. Many fruits and nuts are rich in fiber content. You can consume avocado, pears, bananas, strawberries, lentils, and oatmeal. Third, you should limit your fluid intake just before going to bed. If your bladder is not empty, it can bring an urge to urinate frequently during the night that can disturb your sleep. So, better yet, you should stop drinking fluids at least 2 hours before bedtime. You should avoid a large intake of grapefruit juice along with Tamsulosin. Grapefruit contains a few chemicals called furanocoumarins. These components are able to block the metabolism of many drugs in your liver. They inhibit the activity of one of the metabolic enzymes, CYP3A4, in your liver. This enzyme is a highly essential and abundant enzyme in the liver for metabolism. Tamsulosin is significantly metabolized by this enzyme. So when you take this medication with grapefruit juice, it can reduce its metabolism in the liver. This may enhance the levels of Tamsulosin in your body, which results in more dizziness and lightheadedness. So, while taking Tamsulosin, you should avoid consuming large amounts of grapefruit juice. If you take Tamsulosin along with alcohol, it may make you feel more dizzy and lightheaded. This is more important during the early days of treatment with Tamsulosin. As your body still needs to adjust to this medication, you may experience more dizziness in the initial days. So it is better to avoid alcohol these days. Effects on erection. Many of the alpha blockers, like prazosin and terazosin, can cause prolonged erections in men. These drugs are actually prescribed for hypertension. But due to their vasodilatory actions on blood vessels, they can induce priapism. It is a prolonged and painful erection lasting more than 4 hours, with difficulty ejaculating. Tamsulosin is an alpha-1A blocker that is selective for the bladder. It can rarely cause priapism in 1 out of every 100,000 people. However, it is a serious condition, and it should be treated immediately to prevent damage to erectile tissue. Even though it is rarely observed with Tamsulosin, you should talk with your doctor if you observe any such prolonged erection. Drug interactions. You should avoid a few medications that can lower your blood pressure. Drugs like prazosin, doxazosin, and terazosin should be avoided with Tamsulosin. All these are alpha-1 blockers, including Tamsulosin, which is more selective for the alpha-1A type. So the combination of these drugs with Tamsulosin can induce a significant lowering of your blood pressure. You should also avoid drugs that increase levels of Tamsulosin. Few drugs, like ketoconazole, are strong inhibitors of metabolic enzymes in the liver. So these drugs can reduce the metabolism of Tamsulosin and increase its levels in the blood. This can make you feel more dizzy, lightheaded, and hypotensive. So you should avoid them. A few drugs, used for the management of erectile dysfunction, can also interact with Tamsulosin. PDE5 inhibitors like sildenafil, tadalafil, or vardenafil should be carefully used with Tamsulosin as they increase hypotension. You should also avoid using the painkiller, diclofenac, while using Tamsulosin. Prostate cancer. Tamsulosin can reduce PSA levels in your serum. PSA is the prostate-specific antigen that acts as a marker for prostate growth. PSA levels are elevated in people with prostate cancer. But Tamsulosin can mask this rise due to its lowering effect on PSA levels. Therefore, it is better to rule out any existing prostate cancer before starting Tamsulosin therapy. Your doctor may check PSA levels after long-term treatment with Tamsulosin. Any increase in PSA levels from baseline may indicate prostate cancer. Well, that's it guys. These are the most important information you should know before using Tamsulosin. Thank you for watching this video. Please share your ideas and experiences in the comments area below. If you enjoy this video, please click the like button. Have a lovely day, take care and goodbye.